Great. Well, welcome everyone. I think I've met most of you, but I'm Andrea Wilkie. I'm the Executive Director with Community Futures Central Kootenay. And this is our 9th weekly business roundtable that we've been hosting. It's hard to believe it's been 9 weeks. And the purpose of these calls is to hear from the business community and organizations in the Central Kootenay region, how you're being impacted by COVID-19, to make sure you're aware of available resources and supports for you, and to also bring in speakers that can help answer some of the questions that you may have. So I'm happy we've got a couple of speakers lined up for today. Before we do, I just want to touch on the Prime Minister made an announcement this morning about resources being made available through Community Futures organizations across Canada. We're very pleased to hear that. We don't have a lot of information about what that's going to be. What I can tell you is that we are expecting to have funds for us to be able to provide loans to businesses. And those loans will be for businesses that haven't been eligible for what's been called the CEBA loans through the financial institutions. So those are the $40,000 loans with up to 10,000 of those loans forgivable. Based on some certain criteria, and it's going to be designed to help businesses that weren't eligible for those loans dollars through financial institutions. So that's all I know at this point in time. I know the Prime Minister said call Community Futures, they're there for you. We certainly are, but unfortunately we don't have a lot of information right now. So as soon as we have that information available, we will be sharing it on our website, through our newsletter. I would expect on an upcoming call we'll share that information, but I just wanted to address that in case anybody was wondering if we had further information on that. So great news, and we'll keep you posted as we have more information. So with that being said, I'm happy to introduce Chris back. Chris is with WorkSafeBC. He's the Director for Occupational Health and Safety and Consultant in Education Services. And Chris actually reached out and offered to be on our call to provide some information for businesses thinking about reopening safely. So Chris is a bit of a presentation he's going to go to. I invite you, as questions come up for you along the way, feel free to put them in the chat box. I will wait till the end of Chris's presentation to start going through the questions, but if you want to start putting them in the chat box, that would be great. So we'll have a presentation from Chris, we'll have some time for Q&A, and then following Chris, we have Kerry Lockhart from the Canadian Federation for Independent Businesses, who is going to just point us in the direction of some resources they have available for businesses looking at tools and supports for reopening. So that's the game plan for the call today. We have till 12 o'clock. We may go a little bit over, but I think it's really valuable information. So with that being said, just a reminder to mute your phones. And Chris, I will pull up your presentation and I will turn it over to you.
Excellent. Thank you very much, Andrea. And good morning, everyone. I appreciate all of you taking the time out today to join me and be able to talk a little bit about WorkSafeBC's approach to COVID and what we are doing to hopefully support business as best as we can. For those that have continued to operate throughout all of this, but also those that have had to shut down or have chosen to shut down and are now thinking about starting back up. So as Andrea mentioned, my name is Chris Back. I'm the Director of Consultation Education Services at WorkSafeBC. So we do a lot of the outreach work, build relationships with industries, typically at the industry association level or labor organization level, and really leverage those relationships to promote health and safety. We've been all hands on deck. We fall within prevention division, so with our officers, we work very closely with our officers and other teams in prevention, and we've really been all hands on deck in prevention since about mid-March to be able to provide this support. So if we could go to the next slide, that would be great. What I'm going to do is spend, sorry, I'm not seeing, oh. There, I just want to see, I don't see the next slide coming up. There we go. Oh, is that working? Yep, there we go. Perfect. Okay. So what I'm going to do is spend probably the next half an hour or so just talking a little bit about COVID-19. I won't spend a lot of time there, but where I want to focus most of the time is getting into the controlling of the risks and what you as businesses can do around controlling risk. I'll then bring up a couple other topics. You know, we can spend some time there depending on what people are looking for, but a little bit on psychological safety during this period, working at home, office ergonomics, that type of stuff. Talk about our claims process and how that's working. And then provide hopefully some valuable resources that are available for you on our website and others, and then we can open it up for Q&A. So we can actually jump ahead. So we'll talk a little bit about understanding COVID. We'll jump ahead to the next slide. That's great. Thank you. I think most people are fairly familiar with everything that's on this slide. We know that coronaviruses are a large family of viruses that can cause diseases ranging from the common cold to severe diseases. COVID-19 is just the name of one of the diseases caused by a newly identified coronavirus. As we know, the symptoms are very similar to what you would see in cold or flu. They can range from mild to severe and can appear up to 14 days after exposure. And I think that's the key point that I actually wanted to bring forward on this slide, is because of that 14-day, up to 14-day lag time between symptoms and exposure, it does mean that you can transmit the disease during that 14 days without having any symptoms. And that is much more challenging than what we see with things like the flu or common cold that have sort of a 1 to 3 day period. We're talking about 14 days. So that's what creates some of the challenge here. And we know that transmission is at this point still considered to be droplet, which basically means that as you sneeze or cough or even talk, the droplets that come out of your mouth drop to the floor fairly quickly. We have not yet indicated that it's an aerosolized disease, meaning it gets up into the air and stays in the air, which makes controlling it a little bit more straightforward. But we'll talk about that. So if we could go to the next slide. What I want to focus on in this slide really is how the likelihood of transmission relates to the control measures that you as employers need to be considering as you're keeping your business operating or opening up and minimizing that risk to the workforce. So we know that there are certain factors that increase the likelihood of transmission. The first one being the 2 meters of distance. So as I just talked about, the droplets, as they come out of your mouth or your nose as you sneeze or cough or talk, they drop to the floor fairly quickly. But that 2 meters of distance is a general measure that if you stay 2 meters away from someone, then your likelihood of transmitting the disease from those droplets is reduced. So that's why we do focus on the 2 meters. You know, one of the other challenges is the high frequency of unique people in the workplace. So if you are a retail business, for example, and you have people coming in all day long, what we mean by unique people is different people. So if you have a number of different people coming in, then your likelihood of transmission is increasing, as opposed to, say, an office setting where you've got your workers coming in, but you do not have interaction with the general public or a regular flow of people during the day. So those employers out there that do deal with the public do have a higher likelihood of transmission or risk to your workforce. The potential for working in enclosed areas. We do know that outside is better than inside in terms of transmission, and when you are inside, the tighter the space, the higher the risk. So wide open spaces are much better than tight spaces, so something to consider. I know you won't have a lot of control over that in many of your businesses, but the layout of your floor area and your spacing on your floor and allowing customers and workers to flow throughout, I'm thinking sort of a retail setting, that is something you may want to consider if you're looking at opening back up. The potential for sustained group interaction, so where you have large groups together for a longer period of time, that increases the transmission risk. So hence the large gatherings of 50 people for long periods of time is not allowed at this point in time. The probability of infected persons and inadequate self-isolation practices can also increase the transmission risks. And then that last point there is an important one as well, and we'll get into this when we talk about control measures, is that the potential for regular contact with shared services increases the transmission risk. So it might be countertop surfaces at a checkout, or it might be door handles going into a change room, door handles going into your store. You know, as we're getting into the warmer weather, there might be opportunities to leave your doors and your windows open so that there is less contact with those surfaces. So if we could go to the next slide, that would be wonderful. So I think this is obvious on this one, but we do not want workers that are experiencing any signs or symptoms in the workplace. We also really want to avoid as best as we can any customers in your workplace. But if anyone is experiencing flu-like symptoms, then they should be immediately informing their supervisor. Physically distancing from colleagues and leaving the workplace, seeking medical advice if needed. So 911, obviously, if it's urgent. And then you've also got the self-assessment tool and 811, which is a service that's available to folks. I think you're all probably fairly familiar with that. So let's jump ahead 2 slides, actually. So the next one is just a bit of a title slide, and let's talk about controlling of the risks. So if we can go to the next slide. Sorry, I'll keep talking there as the slide is coming up, but what we're getting at here is around the basic control measures. And really with the basic control measures here, so Andrea, we should be on slide 8. Yeah, there we go. Really what we're saying here is, there are many things that you can do as an employer and as an individual to prevent the spread of COVID-19 in your workplace. But the most important really is to be following the orders, notices, and guidance from the provincial health officer and applying them in the workplace. And a lot of the guidelines that we're bringing forward on our website are developed based on that, and in fact have been run past the provincial health office to ensure that we are aligning our messaging as best as we can. So when we get into the basics, when we talk about physical distancing, this really does mean close contact with others. So it used to be referred to as, or at the beginning was referred to as social distancing. We've revised that to physical distancing because we really don't want people to not be socializing. We just need to be socializing in a physically distanced manner. The other is, so having policies in place to be able to maintain that as best as you can is great. Cleaning and disinfecting. Having practices in place that are cleaning and disinfecting. The reason we use both is cleaning is sort of removing the dirt, so to speak, or dust or other things from the surface, but that doesn't, cleaning with, a wet rag doesn't necessarily mean that you're disinfecting. So you should have the practice of cleaning off the soil as best as you can, and then disinfecting with something that will kill the virus if the virus is still on the surface. And we'll talk about that a little bit more as we go along. Then personal hygiene, so covering your mouth and nose with a disposable tissue or the crease of your elbow when you sneeze or cough, washing your hands with soap and water for at least 20 seconds. Soap and water is the single most effective way of reducing the spread of the infection. If soap and water isn't available, then you can use alcohol-based hand rubs or hand sanitizers as they're commonly known. You want to try and avoid touching your face, eyes, nose, mouth with unwashed hands as much as possible. And when we talk about personal protective equipment, we'll get into that a little bit more. And then also not sharing anything, but food, drinks, utensils, things like that. Could we go to the next slide? So this slide is probably the most important slide that I am going to show you today. And we're going to talk about what we in the safety world refer to as the hierarchy of controls. And you'll see as you peruse that slide that we have control measures for the risk of really any health and safety risk in the workplace, but in this case, COVID, where elimination and substitution is the most effective, PPE is the least effective. So I'm going to go through each of these, but the one thing I want to mention is PPE, which is personal protective equipment. So that would be gloves and masks and things like that. That's where people tend to be jumping to first as we talk about COVID and how they're going to protect themselves using masks or using gloves. That is the lowest form of protection, and I'll talk about that a little bit more in a moment as I go through each of these. So we really want employers to be thinking about your plan, putting a plan in place on how you're going to reduce the risk, but focusing on the higher areas of this hierarchy first before you jump to PPE as the control measure that you want to have in place. So if we start off with elimination substitution. So elimination substitution is really about removing the risk of exposure entirely from the worker or from the workplace. So this can involve eliminating the work tasks or postponing some of the work to a later date if you have the opportunity to do that, reorganizing the work if you have the opportunity for that, or planning the work in such a way that that the worker is not exposed to the risk. So having workers work remotely is an example. If you have the luxury of having some of your staff or all of your staff work from home, that's something you can consider, and you're actually eliminating the worker in that case from any risk that might be apparent at the workplace. Now, at the workplace, we're talking about your primary work environment. Obviously, the workplace with people working from home now transitions to the home, and you still do have responsibilities there, which we'll talk about later. So that's the most effective, eliminating the worker from the risk, or eliminating the risk from the worker, either way. Engineering controls, the next one down. These would be controlling the design of the workplace, using physical changes typically to the workplace at the source of the risk. So an example of this would be installing barriers, plexiglass barriers, that you've probably seen in grocery stores or other settings that are between the checkout, the person at the checkout stand, the worker at the checkout stand, protecting them from any exposure to the customer that is purchasing their groceries. So that would be an example of engineering controls, very effective as well. Administrative controls are next down on the list. They're a little bit lesser effective, and primarily they're lesser effective because they rely on the behaviors of individuals, which are unpredictable. So this would involve having policies or procedures in place, training and signage, things like that, having policies around cleaning and disinfecting, having policies around workers with signs and symptoms not being in the workplace, or customers with signs and symptoms not being allowed in, that type of thing. So it can be very effective, it can be very effective, but there is even the policy or the control measure around physically distancing is an administrative control measure, because you are relying on people's behaviors, relying on people trying to maintain the best they can that 2 meters from someone else. So it's not as effective in engineering as engineering controls or elimination of substitution, but it can still be effective if you have the right training and I'll say culture in place with how that works. And then personal protective equipment, lowest on the list. Again, these are the masks, the gloves, respirators, face shields, things like that. We'll talk a bit more about this. In some workplaces, it's absolutely required, like healthcare settings, where they are treating people with COVID-19 or other illnesses, but it's not necessarily a requirement in other settings. It's not that you shouldn't be using PPE, but it should not be your only control measure moving forward. If we could go to the next slide, I'm going to dig into all of this a little bit more. So the next slide, as it's coming up here, is talking about what employers should be doing, determining who should be at the workplace, creating policies that are in line with the recommendations of the emergency measures that have been laid out by the Provincial Health Officer and the BC Centre for Disease Control. So really what this comes down to is that WorkSafeBC's expectations. So I should be clear really upfront here that we are not able to enforce the requirements that are being set out by the Provincial Health Office or the government. However, we can only really enforce or write orders against what we have within our regulation and in the Act. However, we do have under Section 21 of the Act, which used to be Section 115 of the Act, employer responsibilities. So if we have an officer, if you get visited by an officer and you are not demonstrating any sort of attention or focus being put on how you're controlling the risk, we could write an order under Section 21 of the Act, which is your general duties as an employer. That's not the approach we're taking, not to say that those orders haven't been written. We are taking a very consultative approach to this, where we're out there working with employers to help them as best as we can, so they understand the risk, they understand the transmission, help them explore control measures and put that in place. But in the end, our expectation is that you as the employer have a plan. You do not need to send us that plan for approval. That's also a misconception based on some of the announcements over the last week or so. You don't need to send it to us. We're not going to approve it before you want to open your doors, but you do have to have a plan in place. So if an officer comes to your work setting and asks for a plan, you do need to be able to demonstrate that you have a plan in place and you put some thought into how you're going to control the risk based on the activities within your job or your workplace and the hierarchy that I just went through. So again, considering engineering controls, considering all those controls we talked about, and then really implementing physical distancing measures. And I know that's an administrative control, but it is something that's really important here in ensuring that your workers have training and an understanding of what is needed, what's expected of them. Workers also have responsibilities under the Act and the regulations, so they do need to follow the policies and procedures that you're putting in place. So reconfiguring how the workplace is set up, stopping in-person meetings or revising shift schedules if you're able to do that, and changing work processes and practices. If we can go to the next slide. This is where we talk about travel, and in some cases, travel is still necessary. We are asking employers, or employers should be considering limiting essential travel or even banning non-essential travel. For instances where worker travel is required, then we are asking you to consider practices that will encourage physical distancing. Difficult, not always possible, in which case you may need to utilize personal protective equipment. But where you have an opportunity to have people travel in their own vehicles, or if you do have a large enough vehicle where you can stagger people in the vehicle so that they are 2 meters apart from each other, you know, like a van or even some large pickup trucks will allow that to happen. So it depends on the work site that you're using, possibly increasing the total number of trips that the workers take so that you can have fewer people in the vehicles. And again, if you have to have people within that 2 meter distance of each other in a vehicle, then you want to minimize the length of time that that's occurring. You want to ensure that PPE is provided if it's going to be an extended period of time, and then you want to ensure that you have hand washing and sanitation opportunities both before and after exiting or entering and exiting the vehicle, as well as regular wipe down of the commonly touched surfaces within the vehicle, like the steering wheel, shift knobs, door handles, windows, things like that. So that's what we need you to consider if you're looking at travel of your workforce. We can jump to the next slide. And this is where we're talking about cleaning and sanitation, your hygiene practices. So you do want to ensure that you're providing the supplies to the workforce, soap and water, hand sanitizers, disinfecting wipes, nitrile gloves, garbage bags, depending on the type of work that you're doing. Put up reminders for personal hygiene practices. So this could be posters, policies, something in the lunchroom or common areas that remind everyone about personal hygiene practices. Removing shared items, we talked about that a little bit earlier, but you know, not having coffee or water stations or snack bins or open food trays within your workplace. Disinfecting high contact areas and items. This again could be the countertops, it could be the change room doors, your front door, some of the products out on your shelves, and we'll talk about that a little bit later as well. You want to ensure that your workforce is trained, supervised, so trained on what the control measures are put in place, that supervision is in place, and that you are continuing to provide reinforcement and reinforcing the messaging to your workforce, and that you're documenting any of that training that is taking place as well. And then really ensuring that your staff have the ability to raise concerns. So for those of you that have a workforce of 9 to 20, you require a worker representative. For those that have more than 20 workers, you require a joint occupational safety committee. For those with less than 9, you still need to have someone, typically the owner or manager would be the person responsible for health and safety. You do need to get input from your workers. So COVID is not a reason to stop those practices of meeting monthly with your joint committee. You may even want to meet more frequently, but getting input from your workers along the way is really important. So I kind of spoke about that a little bit, jumping to this next slide here. So maybe let's skip that, but we really do encourage you to continue to have your joint committee meet and get input from your workers as you are working through this issue and controlling that risk. So what workers should do, and this is where, again, I talk about the responsibilities of a worker. So they do have responsibilities under the Act and the regulation as well. So they need to understand what their responsibilities are and following the policies and procedures of the employer. But we also need to understand that workers have 3 main rights. They have the right to know about hazards in the workplace, they have the right to participate in health and safety activities in the workplace, and they have the right to refuse unsafe work. And I want to speak about the refusing of unsafe work a little quickly. or a little bit here, is that, you know, this is a fearful time. We have workers that are coming back to the workplace. They may not have a level of comfort of coming back, some fear that they might be exposing themselves. And this whole idea of refusing unsafe work is a challenge. And this is where, again, it's really important that you're including your workplace in the conversation. You're including your workers in coming up with those control measures, understanding what the risk is. And the more that they're included, probably the more they're going to feel comforted that you as the employer have some oversight over what's happening and around their health and safety. But if you do have a worker that refuses unsafe work, you as the employer do have a responsibility to follow up on that. The worker is to immediately notify their supervisor, and you as the employer to do an investigation, look into the matter and determine whether or not the worker's concerns are valid. And where the worker still feels that things are unsafe after you've had that investigation and conversation, then again, there does need to be a follow-up process in on that. And if you still are unable to come to a resolution, you can bring in worker representatives, your trade union, and if you're still not getting anywhere, then you can contact WorkSafeBC directly, and we will have someone respond to that and help work through that issue with you and the workforce. So that is an important process. You should all be very familiar with the refusal of unsafe work process that can be found in our act and our regulation, because that is something that is coming up a lot in the conversations that we're having with employers. Let's go off to the next slide, please. And I want to talk really quickly about this. I mean, we know the announcement. All of you are very familiar with the announcement that came out on May 6th from the provincial government about our restart plan and the phases that we're going to be going through. And phase 2, we're sort of in phase 1 right now. Phase 2 begins mid-May. Our organization has been tagged, I'll say, as a key organization helping with that restart plan and putting together guidelines and protocols and resources for employers to help restart their businesses. We're in the midst of this right now. My team is very heavily involved in this, and we've basically been working nonstop, including evenings and weekends, for the last week and a half, 2 to 3 weeks back for some industries, in putting together these protocols. We will have protocols up on our website, likely by the end of today, if not tomorrow, for those industries that have been specifically indicated in the restart plan, which is expected to go live on Tuesday of next week. So that's going to include information related to physiotherapy, dentistry, chiropractors, in-person counseling, and other medical services. Provincial parks is in question. We will have some stuff up on our website, although the implementation of that looks like it might be delayed based on some experience that we had over this past weekend. We're looking at retail, we're looking at restaurants, offices. There's many others on the list that you can find in that restart plan. But we are providing as much guidance as we can. We are not getting into prescriptive guidance, because it is up to the employer to be able to come up with their plan based on their environment and their workplace, but we are providing some guidance as best as we can on our website, and that will all be available within the next couple days if you fall within one of those phase 2 organizations. Again, just that starred point right down at the bottom there, and to reemphasize, you are not required to submit your plans to WorkSafeBC for approval, but you do need to have a plan in place if you are asked to show one in a WorkSafeBC inspection. So we could jump to the next slide, which is talking about the guides. I mean, I've actually spoken about this quite a bit already, but there is a guide that we put on our website that is focusing on the steps. So it's a 6-step process that we put in place, focusing to help guide employers through developing their plan. So assessing the risk in the workplace, implementing measures to reduce that risk, developing policies around who can be at the workplace, including policies around sick workers and travelers, developing communication plans and training, monitoring your workplace and updating your plans as needed, and then assessing risk arising from resuming operations. So it really is sort of a plan, do, check, act approach, that continuous improvement process of coming up with a plan and continuously revising or modifying that plan as you see fit. We want you to turn your mind to how your workplace is organized and arranged, the specific activities that are carried out within your workplace and how you're controlling for the risk, your cleaning and sanitization practices, and then any changes or precautions that will, how changes and precautions will be communicated to everyone in the workplace. So jumping ahead here, just a couple more slides. I'll try and finish up in the next 5 minutes or so. I do want to talk about psychological health and safety. Thanks, Andrea, for jumping ahead there. So mental health is important. You know, we know that COVID is impacting businesses, livelihoods, lifestyles. It's impacting everything in every way in terms of what we do. And this is going to have a mental health impact, a psychological impact on many workers, many people, the public coming into your workplaces, everyone. And it's important to remember that mental health is just as important as physical health. And employers should be looking at how they can put measures in place to support their workers as best as possible. So what I've done here is I've listed a number of links. Now, I'm hoping that this PowerPoint can be sent out to all of you afterwards in a PDF form, and those links will be live. I'm not going to go to those links here, but I do want to draw your attention to those links and the valuable resources that are available on our website and on other websites. We are mostly linking to other websites when it comes to mental health because they've got excellent information here, tools and tips and different worksheets that you can use, videos, printable 2-page posters that you can put up in your workplace, various things like that. So I do encourage you to take a look at this and focus some of your time on how you're dealing and supporting your staff through this situation when it comes to mental health. So if we jump ahead 2 more slides, we're going to talk a little bit about working from home. So not all of you have the luxury of having your staff work from home, but for those of you that do, it is a good control measure that eliminates or at least substitutes the risk. But I want you to ensure that you understand that any workers that are working from home still fall under the same rights and responsibilities. So you as the employer need to ensure that your workers working from home have a safe working environment to work in. And that can get a bit challenging, how you're assessing that, how you're working with your workers who are at home to make sure that they're setting up their workstations appropriately and things like that. So, you know, your responsibilities are going to include hazard and risk assessment in the at-home workplace, procedures for working safely in the home, including ergonomics, and I have a slide on that coming up in a moment. Ensuring that they have evacuation procedures in place for emergencies, education and training, workers' duties to follow safe work procedures, reporting any workplace injuries, and check-in procedures if they are considered working alone as well. So it's important that you do pay attention to this, that having a worker work from home doesn't mean that your obligations as an employer have disappeared. They're still there, and you need to ensure that those are in place. So if we jump ahead to the next slide here, this slide provides, again, a couple links to some resources on our website that can help you put that plan in place for workers who are going to work at home, including some checklist information that's on there. And then if we jump ahead 2 slides, we're going to talk about ergonomics in the home office, and just wanted to really draw your attention mostly to the link down at the bottom, which is an excellent resource, very simple resource to use that we have on our website, how to make your computer workstation fit you. Probably be good as an employer that you understand this and also share it with any workers who might be working from home. It talks about how to set up a computer workstation in an appropriate manner that's going to hopefully avoid or prevent any risk of musculoskeletal injuries of the upper or lower body. So I do recommend that you take a look at this. And really speaking to that middle point there on organizing of the workday and activities, it's very easy to roll out of bed, come down to your computer workstation at the kitchen table or at a desk if you're fortunate to have one, and work all day without even recognizing how fast time is going. So we do recommend that that breaks are very important throughout the day. We tend to recommend the 20-20-20 rule, meaning that every 20 minutes you take a 20-second stretch break, stand up from your desk and look 20 feet away from your computer, just to relax your eyes and stretch your muscles. Last couple slides here. If we jump 2 ahead, let's talk about some WorkSafeBC resources. So as I mentioned, we're developing a lot of resources. There's lots up there already with the essential services that have been operating to date. We've also got many that are going to be up in the next day or 2, as I talked about. So it's got a link there right to WorkSafeBC.com. You'll see the sort of home page there. If you click on that kind of blue area down on the bottom where it's got the picture of the COVID virus, that's going to take you to our main site. And it's split up in many different sub-pages that are split up by industry or by topics such as claims, our restart plan, giving some templates, and then all of our industry information is going to be up there over the next couple of days. So I do recommend that you take a look at our website. We also have links to other websites there, which I'll talk about in a moment as well. If we can go to the next slide, I do want to talk about our approach. I've mentioned that the officers will be out there doing inspections. I have my team. We're not officers of the board, so we don't enforce the regulation, but we are doing education and consultation at the employer level. So we're reaching out to employers and consulting and providing guidance, taking a very similar approach to what the officers are doing. The only difference is the officers can write an order if they're not seeing an employer who is putting the appropriate attention towards COVID that they need to be. There's some online resources there for you to link to, but I really want to draw your attention on this slide to the bottom right-hand corner. There's a phone number there. If you have any questions at all, you can call our prevention information line. It is available to you 24/7. The response time is 30 seconds at this point for being able to answer your call. And depending on your question, it can take a bit more time where we'll need to consult internally to get your response, but our average response time right now is within 80 minutes, so about an hour and a half to be able to get you the answer you need. Some will be quicker, some will be a little bit longer, but our average is about 80 minutes. We've got the numbers there, so 604-276-3100 from the Lower Mainland, or for most of you who aren't in the Lower Mainland, or all of you who aren't in the Lower Mainland, then you've got the 1-800 number there that you can call into, and again, it's available for you 24/7. The next slide I'll talk about really quick. It's around claims, and really the main message here is that our claims process is still operating. All of our claim services are still there for you and your workers if needed. And yes, if your worker is submitting claims related to COVID or feels that they have been exposed to COVID in the workplace, we've had lots of those coming in. We follow the same process. It would have to be proven that that the workplace was the worker sustained the illness from the workplace in the course of their duties at the workplace. So those measures are still in place with that one. And there's more information on our website if you want to have a look at that same web page that I just showed you. There is a link to claims and how that claims process will work for COVID. So all that is there. If we jump 2 slides ahead here, we're coming down to the last couple slides. I just wanted to show you, I'm sure most of you are familiar with these resources that are also available to you, the BCCDC, the Office of the Provincial Health Officer, HealthLink BC, the COVID symptoms self-assessment tool from the Ministry of Health, as well as some phone numbers there that will help you. And if we go to the next slide, Andrea, this just talks a little bit about what resources are available from each of those websites. I don't really need to go through that in detail, but there's lots available for you. As I'm sure probably the various futures organizations that are out there are also available to help out. And then the last slide there is just around questions. So I just wanted to say, like, let's open it up for questions here, but I just want to say in summary that really we need you to build a plan. You need to think about the risks, and you need to have a plan in place, and you need to ensure your workers are included in developing that plan and are aware of the plan, that you're keeping an eye on our website and other websites for updated information on how you can develop and keep that plan up to date, contacting your health and safety association or other industry associations for support. And if you're looking for an answer to something and you can't find it, I recommend that you call that prevention line. That's your first go-to. You're going to get the quickest response going that route. You will notice on this last slide, I've included 2 email addresses. You've got mine there in case you want to send me any update questions after this session. And I've also put our team's general inbox, which is consultationservices@worksafebc.com, where we are also monitoring and tracking questions as they come in and distributing those appropriately. So yeah, maybe I'll cut it off there and we can open it up for any questions that people might have.
Thanks for that, Chris. Lots of great information. And I know we've had some questions come in the chat box here. I'll maybe start scrolling through them and speaking to them, but is there anybody that wants to unmute your microphone and jump in with a question?
Hey, Andrea. Hi, my name's Liz.
Sorry.
Sorry.
Go ahead, Liz.
Okay. So a lot of this doesn't pertain, I mean, some of it pertains to my business, but I'm a sole proprietor doing personal service of massage. But I'm in a shared office with other practitioners. So would I just look to some of these guidelines for worker safety to apply to those conditions?
Sorry, just had to unmute myself there. So thanks, Liz, for your question. Good question. We are going to have some information up on our website specific to all of the medical services, including physio, massage, chiro, and others. We may not have all of them up this week. There's 24, as you know, or maybe 26, I think, under the Health Act. So we are trying to work through all of them. What I would say, though, is in a shared office, I really recommend that everyone that's sharing that office is working together on coming up with your plan, and that your plans are in sync, and that you are utilizing some of the recommendations that we've talked about here and what you will be able to find on our website within the next few days. And if you can't find what you need on the website, then please do feel free to reach out to us, again, as I said, through our prevention line or through consultation services at WorkSafeBC.com, and we can help you as best as we can. But I really do recommend that those that are in shared workspaces, that everyone sharing that workspace is working together on coming up with the control measures.
Great, thanks.
Keith, did you have a question?
You calling out me or different Keith? Yeah, I don't have, the only question I would have is we were carrying hand sanitizer for one of the distilleries up in the valley, and they were just mentioning today that they have like a temporary use to be able to produce that stuff. And are we seeing recovery within the supply chain so people can get the supplies they need to do the sanitation they need? And if not, how do we ensure that those distilleries and those local businesses that are pivoting can continue to produce things like hand sanitizer, which they're doing now? Maybe.
Yeah, great question. We don't have a lot of as WorkSafeBC, we don't have a lot of control over that, but we have been involved actually as the government really has been working with those organizations, distilleries and others, to produce more of the hand sanitizer, and even from the perspective of masks and gloves, working with other manufacturers to divert their manufacturing to those types of PPE and things like that. We are getting out there and working with industry, working with the distilleries to ensure that their practices are not creating any other risks. So that's one thing, maybe a bit of a sidebar. So we don't have a lot of control over it, but we are hoping that there is going to be an adequate amount available through all of the distilleries and other manufacturers that are developing the hand sanitizers. If you're looking at doing any of that yourself, you do need to ensure that there's a 60% alcohol content. So we are working with our organizations from that perspective. But again, from the perspective of cleaning surfaces, yes, you do need that sanitizer. But from the perspective of washing hands, personal hygiene, soap and water will work. A lot of people go directly to the hand sanitizer. We actually recommend the soap and water. It is just as effective as long as you're washing for 20 seconds with soap and water, and you won't dry out the skin quite as fast. So there are other benefits of using soap and water through that process as well. So make sure that you have hand washing stations available for your staff as best as possible. And then from a sanitation perspective, in terms of cleaning, any household cleaning products can be used to clean surfaces or any other products that you have. You just do need to understand that there are risks associated with those as well. So depending on the products you're using, you want to make sure that you're not exposing your workforce to other chemical exposures that you might not be used to, and ensuring that you have controls in place for that as well.
Thanks for that, Chris. And I know we've had a few people ask if we were going to share the slides after. Absolutely, we'll PDF them. We'll send them out with the minutes from this meeting. And I think, Allison, with your permission, we can try to just get it posted on the COVID-19 resource section of our website, so people can access it fairly quickly. So going to the questions on the side, Chris, there's one specific question around gyms and when they can reopen, and do they need to submit an opening plan. So I think what I heard you say is next week, and no, they don't have to submit one, but there is a question in there about interior health. So maybe you could speak to that.
So yeah, so let me just pull up the interior health piece. Let me, I don't see it in here. Maybe I'm just not reading fast enough, but let me talk a little bit about the gyms. So at first, we were actually told that the gyms, oh yes, okay, I see it there. The gyms were not going to be included in phase 2 and that they would be coming later. But as you probably heard from Dr. Bonnie Henry earlier this week, that gyms are now included within phase 2. However, the only caveat to that is that the regulations around gyms also are based on the orders that the health authorities are putting out. And this is probably where this interior health piece is coming from is, I know Vancouver Coastal Health, and I think, I want to say Northern Health did not put any orders in place for gyms to close. And so, yes, those gyms would be able to open up as of the 19th, assuming they have all the practices and protocols in place. So we are going to have information on our website. We're a little behind on the gyms because they weren't originally part of our priority list, but now they are. We should have it up hopefully by early next week. For those gyms that might be within the other health jurisdictions, it will depend on the orders that those health authorities are putting forward. So, you know, this comment here around interior health, you would need to be following up with interior health to make sure that those orders have been lifted. And then as long as you have those practices and protocols in place that are recommended, then you should be good to go.
Thanks, Chris. Next question is from a restaurant operator, and they're asking about opening up their patio and what protocols are needed.
So good question with restaurants. In fact, I just finished reviewing our restaurants guidelines that we've drafted internally this morning. They're just going through director review right now. They do still need to go through the PHO, which is happening actively right now today. So I probably shouldn't speak to any of the specific protocols until they're up, but they will be up on our website tonight or tomorrow morning, so you can take a look. But what I will say around patios, what I can tell you around patios is, and as I've talked about a little bit earlier, is outdoor is better than indoor. So a patio, if you're able to have a patio, is actually better than having people seated at your tables inside. You'll be able to do both, but patio is actually less risky than inside. What it really comes down to is the distance between people. So the recommendations coming forward from the PHO are that we're not going to have gatherings of more than 2 to 6 people for the foreseeable future. So you shouldn't have more than 2 to 6 at a table. That's likely the recommendation that you'll see on our website coming out today. And then you need to ensure that between tables, when people are seated, there's 2 meters of distance between any individual people that might be seated at adjacent tables. So it might mean that you need to spread your tables out a little bit more. And when you think about it from a patio perspective, that would still apply out on the patio, that 2 meters of distance. We just know that the possibility of transmission in an outdoor space is less than the inside space. And if you again, as we're getting into the warmer weather here, if you're able to, I know lots of restaurants have big garage door style windows that open up. I mean, open up your windows and get the air flowing on the inside too, and almost make it, if you have the opportunity to make it like a patio inside with the outdoor air flowing through, then you're going to be better off than having an enclosed space. So hopefully that helps a little bit, but I do encourage you to go to our website.
That's a shiny campaign. Open the windows up, let the air in.
There you go.
We're open for business.
Chris, I'm going to jump in with another question for you, and I hope I've interpreted this correctly, but I think the question in it is around if you're hiring a cleaning service to clean and disinfect your office, what are some best practices they should have in place, and any suggestions for choosing a cleaning or disinfection service?
I can't, as a public organization, I can't recommend specific cleaning services, but I would ask that you're all doing your due diligence in researching the business that you want to bring in to do that cleaning service, and they really, as an employer as well, need to turn their mind to how they're protecting their staff. So they should have a plan in place too. You can go to our website and get clearance letters to make sure they're registered with WorkSafeBC, and you should be doing that if you're hiring any contractors, is getting that clearance letter from us, which is available on our website, and it gives you immediate response on clearance letters. So that's important, just to make sure they're in good standing with WorkSafeBC and they're registered with WorkSafeBC. They should have a plan in place, and you might want to ask to see their plan and how they're protecting their staff. But when they come onto your premises, you are considered sort of the prime contractor in that situation. So you have responsibility for the health and safety of any contractors coming onto your work site. Now, it depends on the situation and who you're bringing on and how you're working with them and how many hours you're working with them. And we can't really get into all those details here, but you do want to work with them and ensure they have plans in place and ensure that their safety is considered when you're bringing them on to do any sort of cleaning within your work site.
Thanks for that, Chris. I'm going to go to a question from a hotel owner. So they're asking about, after renting out a room for the night, do they need to wait 3 days for the virus to die before entering and cleaning the room, or can they go in sooner than 3 days?
So that's also a very good question. Now, I should say right up front here that hotels and resorts are not part of phase 2. They are part of phase 3, and the indication is that hotels and other areas of tourism will be coming back on board in June. Now, again, they were never mandated to close, so there's lots of hotels that are probably still open out there. But the reason I bring that up is we haven't developed, we're turning our mind to that on Thursday, basically. We've been focusing on phase 2 this week. We've got everything coming up on our website today and tomorrow. And then basically starting tomorrow, we are now bringing our team back together and we're looking at all the phase 3 industries that are coming back on board. It's going to include camping, hotels, resorts, other areas of tourism, film, many other industries that we're going to be focusing on. So the guidelines coming from us on that are going to still be a few weeks away, but we will have it up before the beginning of June for those industries, those hotels that want to get going on that. Now, the other thing that I hear within that question, so I can't really give you specific protocols on that yet. I don't want to commit to anything, but the one thing I hear in that as well is that sort of that 3 days piece and how long do you need to wait? And this applies to retail as well. And, someone tries on some clothing, does that clothing need to be put aside for a certain period of time? There is some research that's come out from the New England Journal of Medicine that gives length of time for many different surfaces and how long the virus can live on surfaces. And clothing or fabric type materials, right now they are looking at 2 days. Now, it kind of depends on your cleaning practices. So to come back to the hotels question, if you're able to do a deep clean of all the hard surfaces, so commonly touched surfaces like door handles, countertops in the bathroom, fridge doors, things like that within the hotel room, you can sanitize and clean all of that. In terms of the fabric materials, as long as you're taking those out and throwing them in the wash, which I assume you're doing anyways between guests, then that shouldn't be a problem because it is being cleaned. So I don't think you would have to wait the 2 days as long as you have appropriate cleaning practices on all of the common surfaces or all surfaces within the hotel room. But again, I don't want to necessarily commit to anything on that. We will have guidelines on that over the next couple of weeks.
Thanks, Chris. Our list of questions is growing. We've got great questions here. So if it's okay with everyone, I'd love to continue. Does that work for you, Chris?
Yeah, I can stay on. I can stay on for probably till the latest 12:30. I do have another meeting at 1, another one of these sessions actually at 1 that I need to get ready for. So I could probably go as late as 12:30.
Okay, great. And Kerry, I haven't forgotten you. You're still on the agenda here too, so I will make sure we get to you before the end of the call. So I want to jump to wellness practitioners. We have a lot of those in our region, so massage therapists, acupuncturists, etc. Some that operate from a home office or workspace, as well as some that have a rental space. So the question there is around any recommendations for them in terms of working with clients, and suggestions for protocols for those kinds of services.
Yeah, the personal services and I mean this just crosses so many different industries. All these medical services that you're talking about, but we also get into hair salons, nail salons, tattoo parlors, all those industries, those personal services where you have, as the worker, you have direct contact, physical contact with the client. And you are not able to maintain 2 meters of distancing between you and the client. And this has been a high focus for us. And again, I want to draw people to our website. I don't want to start jumping into specific protocols only because we haven't finalized them yet. but I can tell you that today or tomorrow, we will have all of that type of service up on our website with protocols around what we are recommending. And in this case, it does come down to the policies and procedures you have in place, and PPE does play into this a little bit more. So how you're protecting yourself, and requiring the clients to be possibly wearing a mask or be wearing some personal protective equipment if that's possible. Again, getting into hygiene practices, single use, I think about barbershop, single use gowns, if that, or cape, whatever you call those things that you put over you when you're getting a haircut. Words not coming to my mind. Or washing practices, or having a high number of them so that you can wash them at the end of each day. Ensuring that, massage, for example, that your massage surfaces are cleaned in between clients, that any tools or product that you're using on an individual is being sanitized and cleaned in between use. There's going to be lots of that type of stuff, but I can tell you, if you can stay patient with us for another 12 to 24 hours here, please look at our website, go to that main page, click on business resumption protocols. There's going to be a page there, and then it is going to list the industries, and you will very easily be able to see personal services on there. And these aren't going to be like big 20-page documents that you're going to have to read through and digest and figure out how to interpret. We're really putting it in bullet points, and we're getting it down to the nuts and the bolts of what you need to think about and consider, and to put your plan in place. And if you're not getting the answer that you're looking for, again, email me, call our prevention services line, email our consultation services email address. We will help you. We'll do the best we can to consult with you and get you the answers you need if you're not finding it on our website.
Thanks, Chris. I'm super impressed with the resources that WorkSafeBC has, and your ability to take the time to come answer these questions. So another question I saw was in regards to childcare. A childcare center, should we assume that your answer for that is similar to others, that there's information forthcoming?
Yeah, so education and childcare, we've actually split that up in terms of how we're bringing that forward. So we've got education in terms of K to 12, and childcare is all grouped together, and then we've got post-secondary education that's somewhat separate. But yes, that will be up on our website. We're a little bit delayed on that, only because we've had to get more ministry input and other stakeholder input from the education sector. So that might not be up until Friday, but it will be up this week for sure. And childcare will be a part of that, absolutely.
Okay, great. And I've also seen some questions from our arts and culture sector is really a big part of our economy here in the Kootenays. Will there be specific information around performing arts centers?
So performing arts, we will have museums and theaters, and there's another one. Art galleries are going to be a part of what you'll see on our website this week. So theaters are in there for sure. When we get more so into performing arts, so you will absolutely see some stuff on our website this week. But as I mentioned earlier, the film industry is being contemplated for phase 3, and they're sort of saying anytime between June and September. We don't have exact dates on that yet. So there will be other protocols that will be coming out. And I think my thought here is that as we engage with the film industry and more with the performing arts industry, we may see some of those protocols changing as we get into the summer. But yes, within the next couple of days, there will be protocols up on our website related to theaters, including movie theaters, amphitheaters, museums, art galleries, that type of environment.
Okay, great. Thanks, Chris. I want to zero in on a couple of restaurant questions, because it sounds like you've just recently looked through that information and can probably answer some of these. So one is a clarifying question around when can restaurants be opening? Is it May 19th, or is there a specific date? And then the part 2 to that is for outdoor patios, is it required, or is it a good idea to have a plexiglass barrier between your outdoor patio and the sidewalk?
Yeah, good. Those are both good questions. The May 19th is what we are being told. We haven't heard anything different yet from the provincial health office or the government. In the end, it is going to be up to them. We're following their lead on that, so that's not a WorkSafeBC decision. But at this point in time, yes, we are under the impression that May 19th will be the go live date. So restaurants will be a part of that, and will be able to open up beyond just their takeout services. The plexiglass question is a good one. I mean, it depends on the environment. I think again that comes down. That's an engineering control that absolutely provides protection. So, you as the employer are responsible for your workers, and our focus is worker safety. We understand that the public and your customers are obviously an extremely important part of this equation, because without your customers, you don't have your business and you don't have your workers. So giving a level of comfort to your patrons that you are providing a safe environment for them is going to go a long ways as well. So by putting a plexiglass shield up between your patio and the sidewalk is probably going to give your patrons more comfort, but also your servers who are serving those tables that are closest to the sidewalk are probably going to have a higher level of protection and a higher level of comfort. So I don't think there's anything wrong with that. I would say if you have the ability to do that and implement something like that, that's great. It may not have to be plexiglass in that particular situation. It could be other materials. I've seen canvas patio covers that have sort of that clear canvas as well. That could potentially work. The only problem there is that potentially becomes harder to clean. So plexiglass is going to be easier to clean. So I hope that helps. I mean, there's a balance here of what you're putting in place, how much money you're spending, what you're doing that's reasonable and practical. And that's what the officers are going to look for. Is they're going to want to see that you have done things that are reasonable and practical from the perspective of protecting your workers. But also, if you are able to protect the public, then you're probably going to have a more likelihood of that comfort level of people wanting to come back and use your business.
Thanks for that, Chris. I think that's something that business owners are thinking about is what's the appropriate amount in terms of what I need to do. They don't want to spend money that they don't need to spend, but at the same time, they want to make sure that their staff are safe and their guests are safe as well.
And Andrea, maybe actually I can just jump in on that point, because in some of the other sessions I've had, people have actually asked about HVAC systems and whether or not they should have HVAC systems in place, or whether or not they should be modifying their HVAC systems. And again, HVAC, for anyone that doesn't know, is just your heating and cooling system, your ventilation system. And just a quick note on that I don't want an employer to think that they have to go out and make significant changes to their HVAC system, which is going to cost a lot of money, or even implement an HVAC system. At this point in time, again, going back to my comments at the beginning around droplet, that this is a disease that is transmitted through droplet, and it's not aerosolized. If it's aerosolized and gets up into the air, then an HVAC system becomes much more of an important component within your plan. But at this point, we're not there. So I wouldn't worry too much about your HVAC system and not really have to go down that road. Let's focus more so on the control measures at the point of potential exposure, which is going to be between people. So just wanted to pass that along in case anyone is thinking about the money they might need to spend on an HVAC system.
Thanks for that, Chris. That's helpful. I'm going to suggest let's pause there, go to Kerry so he can just share what resources he has available for businesses. And then Chris, if it's okay with you, if there's people with specific questions that want to stick around and have a chance for that one-on-one with you, we can come back to you once we've heard from Kerry. Does that work?
Yeah, no problem.
Okay, great. So I'm happy to have Kerry join us on the call. Kerry's with the Canadian Federation for Independent Businesses. And Kerry and I just chatted yesterday, and he shared with me that their organization has a number of resources for businesses reopening. And so it was going to just point us in that direction.
Oh, good afternoon, and thank you, Andrea. I see quite a few members, some familiar faces and names, but there is a number of you that aren't. And what we wanted to do with the short time that I have here is just discuss some of the resources that we have available to you. And we've opened these resources to non-members as well. So please feel free to access what we have. And thank you, Chris. That was a very good presentation. And you hit on a couple of key things. I know I've got some gyms that are kind of up in the air about what to do. Most business owners, I think, are in the same boat. A lot of them are concerned about what to do. So I wanted to firstly discuss what I sent to Community Futures, and that was our reopening package. We've worked extremely hard to get this reopening package together and get it ready for business owners and employees. The Back to Business kit will provide you with step-by-step procedures for what you need to get reopened if you're, if that's what you're on the cusp of doing. It also provides a ton of templates. The templates are things like the COVID-19 operational plan for your business, a letter to call employees back. We have a template and poster for opening. Just simply, we call it the We're Open poster. We also have request letters for those of you that are dealing with landlords. We have a fairly officially, a legally written up letter to request their help. We also have notice to visitors to the businesses. We have emergency preparedness templates. We also have sick policies as well. And then in addition to that, we have a FAQ section. So, I know everybody's got a lot of questions. I get that. But I'll just run through some of the more common ones. We have people constantly asking us, when's the start of the first phase? Which sectors in BC are currently allowed to open and which ones will be allowed to open in the first phase? What do I need to know before I can reopen my business? If I'm reopening my business, does that mean COVID-19 is over? I'm not on the initial list of business that can open. When can I open? And of course, a very pertinent question, are there any fines for opening my business early if it's not considered essential or if it hasn't been deemed in the phase? So these questions are all available through our Back to Business reopening kit as well. So I suggest to save time, if anyone just wants to reach out to the Community Futures Facebook page, I can provide this kit to them. I'll just need an email and the name of your business, or they could of course call. But I will say that the call volume has been pretty extensive. We've received over 20,000 calls since March 23rd. That's a 6 or 7 week period. We usually only receive about 35,000 a year. So to have 20,000 calls come in that short a period is going to tell you basically there will be a little late time. Right in the middle of this presentation, I even had Darlene from Stewart's News reach out to me because she didn't want to wait on hold anymore. So those of you that are members and know me, please feel free to reach out to me and I'll get you these back to work packages as quickly as possible. But like I said, everyone else, reach out through the Community Futures COVID-19 support Facebook page, get me your email and I'll get these out to you. Like I said, they are pretty extensive and they are step-by-step package. So I think you'll find them helpful. And it's also nice to find a summary of so many frequently asked questions, which again, I'm sure a lot of people in this call are sharing the same questions. So thank you very much for the time, and everybody keep your chin up and let's all stay healthy.
Thanks for that, Kerry. And CFIB also does lots of great advocacy work with the federal government around policies affecting small business. So I think some of the changes we've seen to the supports that have come out from the federal government are thanks to the great work that CFIB does. So we're fortunate to have you as a resource, and we'll make sure to provide links to those resources that Kerry mentioned on our website as well as in the minutes from this call. So I'm going to pause there and see. I know Cody, you had a question. Sonia, you had a question. If either of you want to speak up, because yours are a little bit more specific, you can direct those to Chris or Kerry, or if there's anybody else that wants to chime in with a question, now's your chance.
Hi, Andrea. This is Cody. Can you hear me?
Yep, go ahead, Cody. And I think, Chris, this question's probably for you.
Yeah, perfect. Sorry, I just pulled over on the side of the road here. Appreciate all the information. It's been amazing so far. My question was just specifically, I own a small group training facility and private training facility. And so I did issue a question earlier that was sort of blanketed under gyms, but we're in a little bit of a unique gray area in the fact that we are privately owned. We can really control the sanitization protocols, the amount of people coming in, the time between sessions. My question specifically was, do we still fall under the commercial gym category, or are we more closely associated with the personal services, chiropractic, massage, physio? That's the main part of the question. And I guess, yeah, just to clarify, I had a couple things going on, but was that accurate that you said gyms were going to be included in phase 2, which is May 19th? That's it for my questions.
Yeah, good questions, Cody. I don't. So I'll clarify what I said, or maybe repeat what I said. Is that yes, originally they were not included, but this week the provincial health office did make a statement. I think it was on Monday that gyms would be included. But the caveat to that is that the gyms, it's also up to the local health authorities on whether or not those gyms can open. And my understanding is that at this point, Vancouver Coastal Health, and I think it's Northern Health, and I can't remember the other one off the top of my head, but there's another health authority that did not put any mandates to close or orders in place to close. So those gyms can open up, or could have even stayed open. For the other ones, it's going to be dependent on what the health authority is saying. So for you folks in Interior Health, and for yourself, Cody, I think you're probably going to have to follow up with Interior Health on that to determine whether or not they consider you as one of those employers. I'm not sure how that is categorized.
Okay.
If you don't get an answer that way, Cody, then call our prevention line, the email or the phone number that I put on one of those slides. When it gets sent out to you, call our prevention line, because one of our officers will, particularly in your area, one of our officers will probably be able to answer that question a lot more efficiently than I can at this point in time, just because I don't know the details of your particular situation. It's sort of hard to investigate, I'll say, on my end over the phone like this. So start with Interior Health. If you don't get the answer you're looking for, give our prevention line a call and we will help you as best we can.
Okay, thank you very much, Chris.
And we did have Trevor Reed from WorkSafeBC locally on a call a few weeks ago, and a woman by the name of Juliana with Interior Health. So we can include their contact info again in the minutes, or Cody, I can send that directly to you. And if they're not the right people to talk to, I'm sure they can direct you to the right people to talk to.
Perfect. Yeah, that would work.
Great. Sonia, are you still on the line? Did you want to ask your question?
Hey there. Yes, I'm here. Hi, I teach occupational first aid in the Kootenays here. And I have quite a substantial list of individuals and businesses that need to certify in occupational first aid for new jobs, finishing post-secondary by the end of June as a requirement. First aiders are considered a essential service. I am a first aid trainer with a lot of WorkSafeBC protocols that I already had in place. And so I'm modifying it and being a little bit more diligent on what I'm doing. And I'm just wondering if I fall in that category that I'm able to reopen in June, because I'm kind of in a gray spot because I'm not administering first aid, I'm training in it.
Yeah, that's a question I'm not going to be able to answer, Sonia, but I can help to get the answer for you. Maybe if you don't mind, you could send me a quick email afterwards, and I will connect with our OSH practices team and find out. Now, you may be aware that we did put, with many of the certifications that fall under our regulation, our act, we allowed the extension of the lapsing of those certifications. So for first aid,
yes,
it allow, yeah, so you're very aware of that. I know there's discussions internally right now on whether or not we're going to extend that or not. Now, in terms of whether or not first aid falls into personal services, I'm not sure that we've actually contemplated that, but that is a very, very good question that we need to get an answer to. So I can't give you an answer on the phone here, but if you want to send me a quick email afterwards, I will hunt that down for you and we will get you an answer.
Great. Awesome. Thanks so much.
Yep.
And Sonia, if you need help tracking down Chris's email address, feel free to reach out to us. Is Diana Duke still on the line? she had a question in the chat box that I was going to bring up. I don't know if she's still on, but I'll bring it up on her behalf. So Chris, Diana's with Nelson Kootenay Lake Tourism. And her question in regards to accommodation is, has there been any thought given to a cleaning accreditation? There used to be one years ago, stickers in hotel windows. This kind of accreditation would be a good way to promote safe travel at hotels, or give, I guess, consumers a level of confidence.
So that it's not something that that I'm aware of that we've contemplated at WorkSafeBC, and I don't know that we would necessarily go down that road. You know, the whole avenue of certifications is somewhat touchy, because there's for those that are able to achieve that certification, obviously that's a very good thing. It can be, in this particular situation, obviously be used as a marketing tool or promotional tool for you, and create some level of comfort, I guess, for your patrons and your staff. But it can also be perceived the other way, that if we start to put those rules in place, then other employers can also say that we're making it too difficult for them to run their business. And so we have to balance that. I'm not aware that we are going down that road at all. I would be very surprised if we do. It's not to say that that the industry couldn't regulate themselves that way and come up with that best practice. But I don't think we would be doing that, or we wouldn't be doing it in this situation for COVID anyways.
Okay, thanks for that, Chris. I'm going to ask you one last question, and then we'll wrap it up and give you some time to have lunch before your next call. So just again, with the restaurant industry, regarding physical barriers, if a clear vinyl is washable and cleanable to be sanitized, can that type of barrier be used instead of plexiglass?
Yeah. Yeah.
Okay.
Again, you would just need to think about the whole process. So what are your cleaning practices? So yeah, with the way that you ask the question, if you are considering, as the employer, if you're considering what the cleaning practice is going to be for that vinyl, and ensure that you are regularly implementing that cleaning practice, it should be fine. I think people go immediately with plexiglass because it's very easy just to wipe down. Might be a little bit more challenging with vinyl, but if you have a good cleaning practice in place, then that will create a physical barrier, which would fall into the engineering controls and be a very good control measure for this particular risk.
Does that answer your question, Brett?
Yes, thank you.
Okay, great. Awesome. Okay, so I guess just in wrap up, I really want to thank Chris and Kerry for taking the time to come on the call today. I think that was some really helpful information, and good to know as well that if people have individual follow-up questions, there's resources there that we can reach out to. We'll make sure to include them in the minutes and on our website, and if for some reason you just can't find it, feel free to email me or Allison, and we can get you in touch with that. And then just a reminder, we also have Allison Bjorkman, our Basin Business Advisor Program Manager, on the call. I think we had Wendy Morrison as well. So yeah, the BBA team, they're available to help with questions. They may have the answers for you. They may just know who to direct you to, but they're a great resource as well. And they do have resources on reopening that they can share with you too. So if you're looking for information on the BBA program, it's bbaprogram.ca. And that's where you can find information on their services. Thank you, everyone. Great discussion. Great information, Chris and Kerry. And we'll look forward to seeing you next week. And we'll keep our eye out for that additional information that's going to be available on the WorkSafeBC website. So thanks, everyone. Enjoy the rest of your day.
Thank you, Andrea. Have a good day, everyone.